Health and wellness are more than a destination. They are a process and a journey of personal choice. Come hear from people out in the field, doing the work, bringing health and wellness to many. So welcome everyone. Today I have the pleasure to have a wonderful functional medicine doctor who has her practice in Maryland, and her name is Dr. Anna Sattah. And she is, I'm going to give you a little history about her. She did her medical school at UVA. She went into general surgery and then critical care. And during COVID, she was in the ICU for 8 years. And her experience in that whole time of COVID, as we know, was very difficult, has led her to an opening of how to really help her patients, how to really get well and keep your immune system well. And that led her on her journey to become a functional medicine doctor. So I welcome you here today, and it's lovely to get to know you. And I'm excited because you did do a lot of research and you're helping a lot of people right now who have side effects from COVID and the vaccine. And I'm just delighted that you're here. Thank you for being here.
Thanks for having me. I appreciate it.
So I'd love to just start by saying like a little bit about yourself and maybe
Mhm.
some more details for, our audience, why you chose functional medicine in the end, because that's such an up and coming, wonderful profession.
As you said, I was practicing in the ICU. And at that time, I felt like you really needed to be open to anything that could potentially help your patients because it was a totally new disease. Nobody had any experience with it. And you just had to be willing to look outside the box for anything you could do to support your patients. And initially, I started doing that by looking at autopsy reports that were coming out of like the West Coast and reading the reports that were coming out of New York because the virus hit the US in New York and on the West Coast first, and trying to understand, okay, well, what do we do when that comes to Maryland? And I think it hit Maryland probably about a month later. And I was coming out of maternity leave at that time and going back into the hospital. And I spent a while just trying to research, how do you do this conventionally? What ventilator strategies are the most effective? What should we do? What should we do with steroids? Should we do with vitamin C? Other things that are a little more kind of within conventional medicine. And I felt like we kind of hit our limit with that, where much we could offer. And the more I was researching, the more I started looking into other ways to support the immune system in the first place, so you could help the body fight it off. Because in the US, we have this sense that you're waiting for a drug to be developed and you want the drug to be the cure for whatever the disease is. And at some point, 200 years ago, we didn't have the drug to cure whatever disease, and you had to just support your own immune system to be strong enough to fight it off. And so I started looking into some of those strategies. And honestly, I think by the time patients got to me in the intensive care unit, they were generally too sick for that type of approach to have an impact. But it was certainly something I was researching, some for the patients, also some for my family, so that we didn't end up as sick as the patients I was seeing, and see what we could do to help. And that was when I came across functional medicine as an actual developed field. And at the same time, a couple of my colleagues had gotten the COVID virus early in the pandemic and ended up with persistent symptoms and what we now recognize as long COVID. But back in the spring of 2020, we didn't understand what that was. And because they were physicians and they had symptoms, they had every test they could think of done, whether it was echocardiograms or ultrasounds of the heart and brain scans and MRIs and pulmonary testing and all sorts of significant testing. And we weren't really finding anything that led to treatment for them. And I have multiple colleagues who were sick enough with long COVID symptoms that they ended up leaving the practice of medicine, some from brain fog or from excessive fatigue or shortness of breath. And when you just see how much your conventional training is failing both your patients and your colleagues, and then you have to start looking elsewhere. And that's when I started looking into functional medicine, and I found the Institute of Functional Medicine, and I ended up doing all of their training, and have just kind of never looked back. So,
Wow, that is so admirable. I really admire that you did that because many doctors didn't think like that, and I really appreciate that. So, one of my observations, of course, is that as a nurse, we would give drugs also like just for chronic illnesses, not really to cure, right? So, some drugs are for curing, but others are just for kind of getting you through, and they're all kind of have
yep,
toxicity at some level. So, the public has to start to I understand that. But I
yep.
love what you do because when, I know a little bit myself about functional medicine, but I'd love you to tell our audience, because we've actually never interviewed a functional medicine doctor yet, about what you do and particularly how you're trained for root causes, which I
Mm-hmm.
think is so vitally important.
When I think of functional medicine, the goal is really to understand everything that was going on with the patient essentially throughout their life, so that you understand how did they get to the position that they're in now. And I typically work with patients on an outpatient basis, because if you're sick enough to be in the hospital, you need to get stabilized from whatever that acute issue is, so that you can be an outpatient and be working on things more long term. But if you are working on those longer term issues, then the provider needs to understand, how did you get there and what all led up to this. And if you've had 20 years of chronic stress at home, or you're in the middle of a divorce, or you're taking care of 4 children on your own, or you're not sleeping, or you can't afford to get quality food, or you don't have the time to prepare your food, all of those factors play into what someone's real health outcomes are. And just seeing someone for 10 minutes to say your blood sugar's uncontrolled, here's your metformin, and I'll give you a prescription for insulin next time, that doesn't that doesn't get to what was underlying things. And so you really have to spend that time. And then in conventional medicine, we spend most of our training focused diseases, and how to diagnose someone with a disease, and what are all the different ways that things went wrong. And if you're in rheumatology, what are all the different autoimmune markers, so that I can specify whether you have Sjogren's syndrome, or is it rheumatoid arthritis, or is it psoriatic arthritis, or is it lupus? Excuse me, is it lupus? But all of that is kind of so we can meet these diagnostic criteria. And I need to somehow fit you into the box of, you have an ICD-10 code, and there's a coding system within medicine where you have to find the specific number code or numeric code for the disease that someone has. So you're constantly just trying to put them in a box so you get the right code that you can put on the note that then you can bill for. And if you don't get the code right, then you can't proceed with any of your treatments. And that kind of subclassification, subdivision of medicine, in some ways can be helpful when differentiating two processes is useful. But for a lot of conditions, the underlying cause may be the same. And you can have an underlying cause that causes 20 different illnesses. And if I just understand the underlying cause and I treat that, I don't really care exactly what the final diagnostic code would have been if we looked there. And so it's just a very different approach to medicine. And it's kind of the difference between splitting things and grouping things, or looking for root cause. And so that's what I spend a lot of my time doing, but it's very different. In conventional medicine, you do 2 years of basic science training, and then you spend a year doing clinical clerkships, which means in my program, we spent 6 or 8 weeks in pediatrics and 6 or 8 weeks in
Yeah.
OBGYN, and 2 months in one group and another month someplace else. And then you choose a fellowship or you choose a residency. And I chose general surgery. And so then I spent 6 years doing just general surgery. And I didn't have another pediatrics class or
Yeah.
another,
No.
another OBGYN class
Or
again.
nutrition, I bet not.
Yeah, well, we didn't really have much nutrition to start with.
Yeah.
But you get so super specialized, and this happens with every specialty. So if you're a cardiologist, you spent 3 years doing internal medicine and then 3 more years doing just cardiology. And if
Yeah.
you're an interventional cardiologist, you did yet another fellowship on top of that. And you haven't asked somebody about their hormones
No.
since third year in med school. That could be 15, 20 years ago. And
Yeah.
so, for example, if a woman were to come in and say they had heart palpitations, which is an irregular heartbeat, a cardiologist really can only think about cardiology reasons for that problem. And if that happens to be a perimenopausal symptom, it's kind of hard to recognize that because you haven't thought anything about perimenopause since
Yeah.
third year medical school. And so I think medicine gets very subdivided and you just pick your lane and you only know things in your lane and you kind of have blinders on to everything else. And it leads to patients bouncing from one specialist to the next to
That's
the next to
true.
the next.
I know that for a fact. That's very
Yeah.
frustrating.
One of the things I like about functional medicine is, if somebody comes in with a list of 15 different symptoms and they, are having trouble sleeping and they've got nasal drip and stuffiness and they're a little bit constipated and they feel a little bloated and they have skin issues and they're tired all the time, like a regular in a regular clinical practice, you don't know how to deal with 15 symptoms in one appointment because you look at them as, what's the differential diagnosis, or what are all of the things that could cause fatigue, or what are all of the things that could cause thinning hair, and
Yeah.
you divide it
I
all
know.
out. um, and so patients get bounced from one specialist to the next to the next to the next, and there's not as much crossover as I think would be useful, but our system doesn't isn't set up to encourage that kind of communication because you just have a brief period of time with your patient to address their concern within your specialty and then write down your recommendations and move on to the next. And so functional medicine is a much more cohesive approach.
Yeah, like a holistic
Yeah.
looking at
Yeah.
it. Well, which is nice about you because you have both. You have
Yeah.
both backgrounds, which is really exceptional. But I agree with you, like holistic is looking at what you said, like the whole being, the if they had stress, if they had certain issues with hormones, if they can't sleep, if they so you're looking at the whole thing, if they had a
Yep.
divorce, all those issues do affect us. And
Yep.
then eventually getting to actually the real cause instead of just this is a disease and this is how we treat this disease and you're going to get this because you have this disease. Whereas if
Yep.
we look at what you're doing, what I hear you saying is that we are going to look at the whole person and we're going
Mm-hmm.
to do that. We're going to look at finding, we're going to spend more time with you and we're going to really find what is causing these issues. And then we're going to treat you in a more holistic way. So I think
Yep.
that's beautiful. And
Yeah.
I'm sure you find things also like maybe like a very high stress response or maybe gut problems, right? You probably find a lot of different like emotional problems. Like they're
Yep.
not just physical, right? They are sometimes, but they're also
Well, I
emotional and
think
mental.
in the in conventional medicine, there's a comment about symptoms being supratentorial,
Yeah.
and then tentorium is a layer in at the base of the brain, and it's kind of a demeaning comment, but it basically means somebody is complaining of something and it's all in their head.
Yeah.
And I the more that I learn about conventional medicine or about functional medicine, the more you realize how many symptoms like fatigue and anxiety
Yeah.
and can be related to very, very organic causes. When you see somebody who has dysfunction in their gut microbiome or the bacterial populations in their GI tract, and you do some specialized testing that allows you to see that, and then you direct treatment based on those abnormalities and then their symptoms get better,
Yeah.
even if that test isn't theoretically like a conventional approved test,
Yeah.
if the patient gets better, I believe it. And a
Yeah.
lot of the symptoms that get better are some of these mood based symptoms that we think of as, well, that's totally different. That's psychiatry and it's not
Yeah.
real medicine. And it is. It's just that we don't see the relationship.
Yeah.
Um,
I
but the
love.
relationship of inflammation in the brain or neuroinflammation, which same thing as microglial inflammation, the microglia are these little immune cells that are in the brain, and you have similar immune tissue or immune cells like that in all the tissues in the body. They can be really inflamed, but when they're inflamed in the brain, then people have more cognitive or mood related manifestations of that. And a lot of times that gets dismissed because we think somebody should just be able to think their way out of it or like
Yeah,
just
that's
snap
really
out of it, you'll be fine.
I know.
Uh,
I know.
no,
Especially when you're very left brain and you don't
yeah.
have a lot of that emotional background to deal
Mm-hmm.
with emotions, then you are going to be a doctor like that. You're not going to really address. I think when you have a person who is a doctor, even if they're in the system, but they are very emotionally intelligent, they might just naturally, like you did, make a decision that it's not just one thing. But I
Yeah.
think that requires that emotional intelligence.
And it requires the time to
Yeah.
be able to spend with your patients
Yes,
because
true.
the people that I went to medical school with, they're all amazing people.
Yeah,
They want to help everyone. And I think that's a pretty universal characteristic for people who go
yes.
into medicine. But the way our system trains you, you become much more of a narrow technician and you just have to figure out, how do I fit somebody into the right box so that, I can finish these notes, so I can get everything out. And that's not what any practitioner that I know wants to do,
No.
but it is what a lot of people end up in. And I feel very fortunate that I found functional medicine and discovered that I actually could change my career to something that I just really enjoy.
And it
I
sounds
think
like
it's
you
fascinating.
believe in it, like you really help
Yeah,
the people too, which is so
yeah,
cool.
yeah.
I'm curious. Okay, so we talked a little bit about like you're going to look for the root cause. You're going to look at the whole person. I think what I want to understand from this is what kind of patients come to you. Like I know
Mhm.
you don't just get COVID patients,
Yeah.
obviously. Yet, so what kind of person would you see? What kind of complaints and maybe
Um,
illness?
frequently, what I see are people who have sort of non-specific symptoms, who have gone to multiple doctors, haven't really gotten answers from conventional medicine, and are frustrated. And then they're coming to look for an alternative approach.
Okay.
And a lot of times it's symptoms like fatigue or abdominal pain, different autoimmune diseases, and how to get better control over those, different GI symptoms, and skin reactions that won't clear, brain fog that doesn't clear, some cognitive decline patients who are having more cognitive issues, but symptoms where they come in and they say, I've seen my regular doctor. He sent me to a neurologist, and I also saw the rheumatologist, and then I saw the cardiologist, and they keep doing all this testing, and everything comes back negative, and I don't know what to do because I still feel crappy.
Yeah.
And I see a lot of those kinds of patients, I, and I think it's really interesting to be able to spend some time to try to unwind, how did they get to where they are. Um, one one thing I thought was really interesting about functional medicine that we really learn very little about is liver failure and or liver dysfunction. And my conventional training about liver issues and how to support, don't drink too much alcohol
Yeah,
because that's
I know.
toxic for the liver.
Yeah.
Like, don't overdose yourself on Tylenol because that's bad for the liver. We're starting to get more education about how obesity can lead to liver dysfunction on basically fat deposition in the liver and can cause problems. And some people get autoimmune liver disease. And if that's the problem, then we give steroids. Like, that kind of summarizes the majority of what I was taught. Since I was in general surgery, I also learned how to do liver, well, I was a part of liver transplants,
Yeah.
and to care for them after they had had surgery. If you actually were going to perform those surgeries, you do yet another fellowship in transplant. Um, but you see the extremes where it's like we don't really have many ways to support healthy liver function initially, other than try to not poison your liver. But if it gets really bad, well, now we have a transplant. And I guess since I've gone to medical school, we do have antivirals to treat hepatitis C, which I think is really helpful. But in functional medicine, they have so many ways of supporting normal liver health because the liver is supposed to help clear your body of normal metabolites and toxins and things that just accumulate because you're alive. Like
Yeah.
it's just normal. And part of that is that you need to have regular bowel movements because when the liver filters the blood and creates bile, which has some of the toxins that have been filtered out, that goes into your GI tract. It's what makes your stool brown.
Yeah.
And if that's not getting out of your body, it's a problem.
Yeah.
And that means constipation really matters. And in my training, constipation is just sort of a nuisance complaint that you tell people, well, yeah, just
Yeah.
take some Miralax. And, you have a list of things you can tell someone, take this and then take this and then take this so that they're not complaining. But I never really thought of it as a major problem with the elimination pathways in the body and just how many issues that can lead to in the future. And that's the kind of root cause type thing that functional medicine would focus on. Fixing
Yeah.
fixing that in the short term is not going to reverse somebody's flare of their autoimmune disease in their 3-day hospital stay,
Yeah.
but addressing that as an outpatient, I think, can make a huge difference in people's lives.
I'm sure you see people with all kinds of problems, gut problems, obesity. I
Yeah.
mean, diabetes, I bet, because like that's so common now,
Yep.
unfortunately. But all kinds of issues, people can come to you, and then you'll look at this. And I mean, that's wonderful. And I agree because we teach that in our course about the elimination pathways. If they're not working properly, and also we're just inundated with toxicity right now on this planet. So I know recently, just to share with you, I had a test with microplastics in my lungs. I actually had
Yep.
them. And they don't even
Yep.
have, I don't even know if they know how to test that in the mainstream. But with the doctors I know here in the Netherlands, they have bioresonance and ways to check that. And I am feeling a lot better now that I'm cleaning that. So sometimes,
Yep.
and that is obviously affecting the liver. If you have a lot of
Yep.
those microplastics in your body. So I'm sure you deal with all kinds of things like this, which
Yep.
is so cool. I love it.
Yeah.
So thank you for sharing all that. So anyway, I want to talk a little bit about long COVID because this
Mm-hmm.
is for some people really a problem. What are
Yep.
the signs? Like, what do people feel when they have long COVID?
I think it's really variable. I The definition of long COVID, depending on who you read, is something like patients have persistent symptoms that last at least a month. Most people, I say, at least 3 months after a COVID infection. But those symptoms, I've seen lists of at least 200 different symptoms. So
Wow.
it's a very diverse kind of syndrome that says you got COVID, something changed, and now things are different. So it's not a very precise definition. Um, what I see most commonly is fatigue and brain fog. And a lot of times that fatigue is patients describe post exertional malaise. Basically, they'll be sort of okay as long as they don't do anything all day. But if they try and do something like get up and clean the house or go to work or, focus on a project or something that requires more exertion, then they just crash afterwards. And that sense that you've essentially used up energy your body doesn't have. And I see that a lot with long COVID. There are people who report loss of taste and smell, some people who have changes in their mood, they can have trouble sleeping, they can have GI issues. So it can be a fairly broad range of symptoms. We also see people who have reactivation of viruses that I think were already in their body, but were just dormant. And that's normal. Like most patients have Epstein-Barr virus in their body. And I think the rates are somewhere around 97 or 98% of adults have Epstein-Barr, which is the virus that causes mononucleosis.
And fatigue.
Yeah.
Yeah.
Yeah. So that virus, you had it, you had acute infection, you felt crappy, eventually your immune system fought it off and now you are recovered, but you haven't necessarily annihilated that virus from your body. It's just now dormant and your immune system is keeping it under control. And I think when COVID hits, and this can happen for other reasons, not just COVID, but I think it can weaken the immune system enough that then another virus starts to flare. We know this happens with the shingles virus, that people get
Yeah.
chickenpox. And then, you don't have chickenpox your whole life, but somehow when you get to be 60 or 70 years old, the virus that was sitting dormant in the nerve roots wakes up and causes a flare, and people have severe shingles. And so I think that kind of reactivation is much more common.
So that just seems like if that happens, that
Mm-hmm.
the immune system, COVID put a lot of stress on the immune
Yep.
system so that
Yep.
that allowed it to happen, right? I'm
Yes.
just clarifying that it was
Yeah.
a tremendous toxicity to the immune system on some level.
Well, I think it did a lot of things because I think it can dysregulate how your immune system is reacting. In some ways, it can make your immune system more reactive, so it's more trigger happy, responding to things it shouldn't. In other ways, I think it's weakened in that it's not keeping these viruses in check that have been in your body for a long time, and so they kind of wake up and are reactivated. So that can be an issue. We also see people who start having more food sensitivities, more histamine reactions, and then more, histamine is released by mast cells, which is a different kind of immune system or a different kind of immune cell. And you get a sense of that, if you took your arm and you scratch down it like this with your fingernail, and you look down and a minute or two later, you have this red line. That's called dermatographism. And that happens in people whose mast cells just sort of react more prominently, more easily.
So that's
And
just bio individual, like people are just different.
people are different, but I think that people can start to develop mast cells that become more trigger happy.
Okay.
And so we see that type of response after COVID too, that some people, the way it affects them is that it's made their allergy type symptoms, mast cell symptoms, histamine symptoms much more reactive. We also know COVID can cause COVID, and I think this persists with long COVID, can irritate the lining of the blood vessels or the endothelial lining, which is you're supposed to have this smooth, slippery lining on the inside of
Yeah.
all your blood vessels. And that can get irritated and eroded away. And then you have blood flow problems. And there are theories about microclots being
Yeah.
formed. And I think that is certainly happening in some patients. My guess is that the patients who got COVID and had microclot issues may have had more of a predisposition to clotting problems to start with. And then COVID was the thing that pushed them over the edge. Whereas somebody who maybe had an immune system that was more prone to inflammation, COVID is the thing that pushed them over the edge, but it pushed it over in a different way. And so they have different symptoms. Um, but it's a really broad ranging condition. And I think that means you got to take a broad ranging approach to what to deal with it. Um, it also looks like it probably disrupts hormone balance in a lot of patients. And if you have a woman who's in her mid 40s and then they get COVID, and now you already were starting to have fluctuations in the hormone cycle, and then COVID can affect the ovaries, and there are ACE2 receptors on the ovaries. The ACE2 receptors are the receptors that allow the virus to get into the tissues. Those exist on the ovaries just like they exist in a lot of other tissues. And so if you start having dysfunctional hormone production, then some of the symptoms that patients experience, I think in some patients can be perimenopause related. And then for those patients, you need to be able to recognize that and realize that for them, they need hormone support or they might be a candidate for it. So it's very different in different patients.
Are you seeing also things in younger people?
I have seen some, I would say more commonly, I see patients probably in their 40s and 50s
Oh,
and 60s. I have seen some younger patients.
okay, so these long COVID symptoms, people come to you, and then how do
Mhm.
you help them?
Um, it depends on their specific symptoms. And if their symptoms are leaning a lot more towards not having energy, particularly when they describe the fatigue and the kind of post-exertional malaise or energy crashes, that to me sounds very much like mitochondrial problems. And the mitochondria are the little organelles that are in every single cell in your body that produce energy or ATP. And you need ATP production in your heart, in the neurons in your brain. You need it in the liver cells for the liver to function well. You need it in the skin cells. It's just that the skin is a lot less metabolically active than, say, the brain is. So you don't need as much mitochondria. But we think that in some patients, COVID can cause a dysfunction in mitochondria. And there are some nutrients that you can use to try to support that. A number of B vitamins and magnesium and CoQ10, and you need adequate iron levels. And so there are some basic nutrients. There are also patients who can just be different in the individual micronutrients and in the individual enzymes they have in their body that are used in it's called a Krebs cycle. That's the biochemical cycle that you use to make ATP. And so somebody might have a Krebs cycle with one of those enzyme that's not quite the best version of it or a little bit more sluggish. And so maybe they need a little more support. And there are some specialized tests that I can get on functional medicine where we're looking at the breakdown products of some of the steps in mitochondrial function, and you do it on a urine test, and you can go back and look at those and say, hey, if all these numbers are built up high, it means that these metabolic pathways are not working smoothly, so all this stuff is building up and spilling over into the urine, and that's a problem. And I think about that test kind of like, I live in the DC metro area. So there's an interstate bypass that goes in a loop around the city called 495. And if you're on the Beltway and there's an accident or construction someplace, because you see all of the cars built up behind that accident. And the same thing can happen in a biochemical loop where you have to get from step A to B to C to E and around in the circle. If the conversion from step B to C can't happen very effectively, then you can have a buildup or like a traffic jam upstream from that. And you can look for those kinds of dysfunction in some changes in the metabolites in the urine. And this is not something I learned in medical school. I mean, I learned about the biochemistry, but I never learned anything to do for it clinically. And what I was taught in conventional medicine is that mitochondrial diseases are devastating diseases that are diagnosed in early in life, generally in pediatrics, and most of the time when
Yeah.
patients are babies. And if your mitochondria don't work, like if you don't have the energy for your diaphragm to move and for you to breathe, and you're a baby, you're born and you can't breathe and you're on a ventilator, or you have severe neurodevelopmental disorders early on. And so I've always thought of mitochondrial diseases as these things that are super extreme and kind of almost not compatible with life. They're just so devastating. But you can have acquired reasons that develop over time that meant that your mitochondria used to work okay, but you've started to accumulate enough damage that after a while they don't work as well as they used to. And there are a lot of broad ranges of presentation if that's happening. And I think COVID certainly can can cause a big hit to the mitochondria. And if that's the way the patients are presenting, then yeah, we do a lot of mitochondrial support. As sometimes we do it with the testing, sometimes we don't. It depends on the patient, on our discussion, because some of the tests can be a little expensive. But that would be mitochondrial issues. We see some people who have more immune related issues, and then we may be working more on antihistamines and different ways to decrease inflammation. We'll talk about inflammation that can be coming from the diet and what types of food they're eating. We try to make sure that they have adequate levels of a lot of the nutrients that are just helpful. Like I want to make sure people have adequate fish oil and magnesium and vitamin D, that their thyroid is optimized. And so some of that you can get through lab testing. We'll also look at gut function, and I do some specialized testing where you look at the bacterial populations in the GI tract, kind of like a PCR test, like the PCR test they have with COVID, but you're just looking for GI bugs that live in the stool. And then depending on what we find, we can target some treatments for that. And a lot of times people can have pathogens, but they're not pathogens like severe enough for me to want to recommend like strong antibiotics.
Yeah.
They're and what's nice is in functional medicine, we learn about a lot of antimicrobial herbs that I think are a much more gentle way to address those populations as compared to the like nuclear bomb approach of
Yeah.
let's just kill it
Yeah.
all with antibiotics.
Yeah.
And I mean, as an ICU doctor, I am very familiar with strong antibiotics. And
Yeah.
if you're in my hospital and I'm treating you for sepsis, yeah, I don't really care about your gut microbiome.
No.
I'm going to be
Like
trying to
that.
kill off
Yeah.
whatever puts you on the ventilator with whatever antibiotics I need. But then you have to recognize after that that, okay, you might have put out the fire, but you definitely caused some damage in the process. And what do you have to do to rebuild that? So it's a pretty comprehensive approach.
What about SIBO, small intestinal
Uh,
bacterial overgrowth? Is that something that is
um,
directly linked to COVID, or is that different?
it's another symptom, and I would say COVID can definitely disrupt the bacterial populations in the GI tract. SIBO or SIBO, or small intestinal bacterial overgrowth, is is very common, and it can be, when I think about the GI tract, you start with the stomach. And if you have a lot of gas in the stomach, you can belch. It can, it just
Yeah.
come up. But then at the end of the stomach, there's a sphincter that tightens down. And then you have the small intestine, and you have a lot of small intestine. And then there's another sphincter, and then you have the colon, and then you can come out. So if you have gas that's produced in the colon, you pass it naturally, and maybe it's embarrassing or maybe it's not, but it comes out. Or you can belch. But if you have a lot of bacteria that have grown up in the small intestine, and then they're essentially fermenting your food, and you have this gas being produced in the wrong area of the GI tract, then it gets stuck and people get really bloated, and it takes a long time for that gas to finally dissipate, and it's really uncomfortable. And that can happen for a number of reasons. When the name of it is just small intestinal bacterial overgrowth. So
Yeah.
you think about it as the bacteria in the GI tract, and we could just give something to treat the GI tract, treat those bacteria. But I also think about, why did that happen in the first place? And if you don't have adequate bile salts and pancreatic enzymes, the bile salts, which are coming from the liver, enter into the GI tract just after the stomach, and they suppress bile flow, or I'm sorry, they suppress bacterial growth. And so patients who don't have enough bile are more prone to having the bacteria grow too much. The same way, if people don't have enough digestive enzymes or digestive function,
Yeah.
and so the breakdown of their food in the stomach and the acidity in the stomach's not as great, and so they're delivering more intact food a little further downstream. The only way to break that down is with bacteria.
Do you give those bile salts then? Do you give those enzymes or recommend?
It depends on the patient's symptoms. The stool test that we do has um, looks at whether people are absorbing all the fat in their stool, and you need bile salts to absorb fat. So if they're not absorbing their fat well, then yeah, I give bile salts or other amino acids that help support bile acid production and bile salt production by the liver in the first place.
Very good.
And you can give other digestive enzymes that support things. We also look at the motility complex or the migrating motor complex, which is just the like squeezing function of the GI tract to move things downstream. Because if the gut is kind of sitting there stalled or like almost in stasis, then you're not naturally sweeping things back downstream, and you need that clean out process to be happening regularly. And so yes, SIBO can be an issue, but I think then you have to say, well, why did the SIBO happen too? And so we get into all of that.
And you know, a lot of people are on these acid pump. They're like stressed out, and then their
Yep.
acid is going the wrong way, and so their whole digestive tract is not working.
Yep.
So sure that you address all the exercise and all that because it's not
Yep.
obviously one issue. But
Yep.
it's lovely. I love so getting back to COVID, just one more
Mm-hmm.
thing. What kind of patients are more at risk? Obviously, people who have a low immunity, right?
Mm-hmm.
Or people who are older and have more toxification, maybe a slower liver.
Mm-hmm.
Um, I'm just curious how you look at that. Are there certain ethnic groups that,
Because I'm seeing patients who already have symptoms, I am less concerned about ethnic groups because I'm only seeing the people who ended up with the condition. And
yeah,
whether you were, you know, 10 out of 10 people in your group ended up with the condition, only 1 out of 10 ended up with it, you're the person who ended up with it. So
yeah, of
I
course.
haven't looked at it so much from that standpoint. I know I see a lot more women, and women is
But I
or
wonder, yeah.
yeah, long COVID is definitely more common in women. And I think the last time I was looking at numbers, it was about double. There's a lot of different ways to look at it.
Do you have an idea of why that is? Hormone?
Autoimmune disease is also more
Yeah,
common in women, and we're seeing it kind of in the 40s and 50s and 60s. And so hormonal changes are happening in women. And there's some thought that estrogen is, well, estrogen has some anti inflammatory benefits and can be protective for a lot of patients. And as women get older, they lose that estrogen protection. So I think that's part of it. But the same issues of like women having more autoimmune disease and an inappropriate response of the immune system attacking the body. And I think this can be similar. So the reasons are probably different. I think hormones probably play a role, but that's probably not the entire picture. And then it may be somewhat social, just who's willing to go to a
yeah,
functional
that's what
medicine
I was
doctor in the
thinking.
first place
Because
versus,
women are more holistic in a way. A lot, I don't want to say all
yeah,
of them, but experience, yeah. So
who's open to this approach.
you have to look at all those variables. That is so
Yeah.
wonderful. So,
Yeah.
how can people contact you and how can they find you? I think that's really important.
I have a website with Insight Functional Health, which is my practice. And there are a lot of videos there that talk about long COVID and other aspects of health. But um, because of my interest and my background, I've spent a lot more time recording things on long COVID. I have a lot of opinions about a broad range of things.
Wonderful.
But yeah, my website's on there.
We'll have all your
Yep.
information so that people can contact you. But continue, sorry.
Oh, well, and people can also find me on the Institute of Functional Medicine website.
Wonderful. And I just have one last question because I
Yeah.
really respect and I really love that you do what you do and you went on. That took a lot
Mhm.
of guts. I think it's very brave to do something, pioneer a new thing, a new idea. I do
Yeah.
see in my work a lot more people are wanting other and they're looking for these things. So I'm
Yep.
curious where you kind of look because in this interview we've talked a lot about the issues of the medical system and of course, we're not blaming anybody. A system is a system, but we do need to change it. And how would you see yourself as a functional medicine doctor really helping to make like kind of make the bridge, like help our system heal?
So I'm trying, when I told you before that information was so siloed between specialties. It's siloed there, but it's also siloed between the conventional medical system and kind of non-conventional providers, and whether it's acupuncture or chiropractic or naturopathic medicine. Like, I had honestly never heard of naturopathic medical training till I was roughly 20 years into my medical training. And I didn't even know that was an option, and that there are whole medical schools of naturopathic medicine. Like, and
Yeah.
it just shows you how separate those are. And I'm trying to continue to maintain sort of credibility on both sides. I
Yeah.
still work in the ICU.
Right.
I still treat people, and if you come in with an acute heart attack and you're going to go for a catheterization and pull the clot out, like, I'm still involved from that side. But that means that conventional doctors know me as the ICU doctor.
Yeah.
And so it gives me, if I say as the ICU doctor, oh, by the way, CoQ10 might be a really good option, or maybe we should think about some magnesium, it it's helpful. Um, and and then on the more alternative side, I think it's very common that once people flip over into alternative medicine, they lose contact with all of their prior colleagues, and they
Yeah.
really don't see anybody on the other side. And so I'm trying to avoid that. And I'm a part of our local medical society, and I actually just gave a talk to them last week about long COVID and different ways of
Awesome.
approaching it. And
Good.
the physicians I was talking to were very interested. It's hard to
Good.
implement within the system that they're working in, but they're interested in it.
Maybe they'll refer some of
Well,
the patients to you. That would be
yeah.
very good if they did that.
Well, my hope would be to get interest at a more policy level,
Yeah,
where
of course.
insurers
I
were looking
understand.
at patients who couldn't go to work and things, and
Yeah.
decide, maybe it's better to do functional medicine rather than to pay out disability claims.
Yeah, it will come. I think we have to have be hopeful, right? And I know
Yeah.
like I'm in a program to get a PhD in integrative medicine, and
Mm-hmm.
I like that word better personally.
Mm-hmm.
I like the idea of integrative, and I like the idea of new clinics coming, like where you'll be working with a lot of other therapists and new thinking, new ways of thinking to really look at the whole and just
Yeah.
what you're doing now. And also I do feel as a nurse, because I was at Georgetown so many years, that I do feel in my heart a need also to help the
Yeah.
system sort of heal. So I love your work. Thank you so much, really, for being with us today. I'm very
I
grateful.
realized I didn't mention this beforehand, but um, we were talk we were talking about different pathways that can get involved. And one of the pathways is the vagus nerve, which is the nerve that controls the relaxation response. And so many of my patients are kind of stuck in this chronic fight or flight state. And I think that's not unique to COVID.
Mhm.
That, and I think some of what may have happened that caused COVID to be so severe is that not only did you get the infection itself, but you got the infection at a time when people were scared witless of what would
Yeah,
happen.
yeah,
And I think that fear is real. And I mean, I certainly experienced that, and I was terrified to get the infection myself. But I think if you have that state and then you get an infection, it affects how you respond. And there are so many ways in alternative medicine and like different healing practices and spiritual practices where they focus on ways to relax the nervous system. And whether that's singing or chanting or humming, or if you think of like yoga and doing
meditating,
um,
right?
yeah, deep breathing and om breathing, all of those things have very physiologic benefits.
Yeah.
And I was at a conference last summer, and they were talking about the vagus nerve, and that's the nerve that controls this. And it commute or the signals travel along that nerve and use nicotinic acetylcholine receptors.
Mm.
And separate from all of this, I have been reading some research about the use of nicotine patches in long COVID. And I've started using them, and I think they really help a lot of patients. And when I was going to the vagus nerve talks, and you realize the vagus nerve is hitting the same receptors, and the benefits I'm seeing from the nicotine patches, I think it's this same thing. And it just keeps being many different light bulbs. We're like, oh, this is related. Oh, and it
Yeah,
ties to this.
it is so interesting that you just mentioned this because I know a lot, three people who are having issues with their vagus nerve from just, I think, just too much stress. They're just not
Mm-hmm.
able, they're like almost near a burnout, actually. A lot of people in the world are at this state, and COVID did not help. So I
Yeah.
mean, even we had discussed the vaccines, but all of it did not help. It was
Yeah.
all big stress on us and the lockdowns and all that. Some people love them and others are really traumatized by them. Many young people didn't like them at all. So
Yeah.
I think we're seeing a lot of that too. But
Yeah.
yeah, I'm grateful for this whole discussion because I think we need to discuss this as humanity needs to be not judging, be in a state of just listening, and
Mm-hmm.
then we can really help people. And so I'm really grateful, like for you, because you are willing to be a pioneer and do something like amazing and different. And many doctors don't understand probably, but I think in the future they really will. And I
Yeah.
think they'll understand. So thank you so much
Thank you.
for being with me. And
Thanks so much.
yeah, I wish you the best in your career.